Hello, my name is Professor Prasanna Sooriakumaran, also known as Prof PS for short. I'm a world-leading prostate cancer and benign prostate enlargement surgeon. I practice on the NHS at University College London Hospital and privately at the New Victoria Hospital in Kingston, the Cromwell Hospital in Earls Court, the Mayo Clinic and Harley Street Specialist Hospital in the Harley Street area, Liverpool Street Diagnostic Centre, near Liverpool Street and at Canary Wharf as well. So I have a large variety of practices to see patients in. Today I'm going to talk to you about benign enlargement of the prostate. So what is benign enlargement of the prostate? Well, every man has a prostate and it starts to grow as you hit middle age and beyond. And so the average man's prostate at 30 might be 20 to 25 grams, the size of a walnut, say. But as you get older, maybe 60, 70, it gets larger. And because the prostate lies downstream of the bladder and lies as a sort of donut around the neck of the bladder, as it gets larger on the inside as well as the outside. And so the hole through the middle of the prostate gets smaller and smaller. And if you remember from Pascal's law in GCSE or O-level physics, if the hole gets smaller and you can't exert more force, because the bladder is also a muscle and therefore gets older with age and therefore can't push any harder, then what has to happen is that the flow has to go slower. And so typically men who have benign enlargement of the prostate tend to be older men. They tend to have a slow, weak flow. Perhaps they can't hit the back of the urinal like they could when they were younger. It might dribble at the end. They might have difficulty starting and stopping. They may have to physically push in order to get the urine out. They might sometimes not get all the urine out, and therefore they just keep emptying the top of the bladder, and therefore they go often. So they may wake up at night 3-4 times to pass urine. They may go a lot during the day, pass small amounts. They may get this sense of urgency because there's urine constantly left in the bladder. That can irritate the bladder and that can cause urine infections as well. And really occasionally, if they can't pee at all, they can go into this condition called acute retention of urine, which is an emergency, and they need to have a catheter put in. If that's not the case and it's just this gradual worsening of your symptoms as you get older due to potentially benign enlargement, there are a few things that need to be done. We have to make that diagnosis and we have to exclude prostate cancer. So I'm a prostate cancer expert as well, which is why I look after all things prostate related. So if you were to come and see me, I would check you for prostate cancer, make sure there was no risk of prostate cancer with a PSA and possibly a non-invasive MRI scan. And once we've excluded prostate cancer and we're just dealing with benign enlarged growth, then I would do a variety of other tests. Check that the kidneys were working properly, check that you're not diabetic, do tests to see how good the flow is, and then also potentially do scans or cystoscopies where we look inside to assess the size of the prostate before deciding whether you need medications. There are medications that can be used that relax the muscle of the prostate to allow you to pee a bit easier. There are medications that can actually shrink the prostate, although those medications tend to have some side effects. And so the other thing that is often done nowadays, and at the Cromwell Hospital we have the latest state-of-the-art surgical kit in this, is called Aquablation, and we have the Hydros, the artificial intelligence enhanced Aquablation device, which only 2 private hospitals in London have. And what that allows us to do is very precisely target that obstructive prostate tissue and vaporize it with a very powerful water jet. And that has been shown to have very good outcomes for patients with less side effects, and specifically it doesn't affect the erections and ejaculation in the way the kind of old-fashioned operations do. And so there are lots of really good treatments that are now available, and I would really encourage men who are getting older, who are struggling with their waterworks, finding it more difficult to pee, to come and see an expert urologist like myself, especially someone that specialises in prostate disease, prostate enlargement, and can exclude prostate cancer. Thank you so much.